Hi, and welcome back to Politics and Polls, podcast of the Princeton School of Policy and International Affairs. I'm your host, Sam Wang, professor of neuroscience and director of the Princeton Electoral Innovation Lab. My co-host, Julian Zelizer, is away this week. This spring, colleges and universities nationwide, including here at Princeton, sent students home when the novel coronavirus started spreading in the United States. Now, months later, COVID-19 has only started to come under control in parts of the country, and in the South and the West, it's taking off with a vengeance. Under these conditions, can schools possibly reopen safely this fall? Now, in most people's minds are the physical precautions, sparser classrooms and dorms, and maybe not letting all the students come back at once. But what about the neuroscientific and the psychological aspects? How will young people's minds and their brains respond to the challenge? And I should say that as a neuroscientist, I have a pretty strong interest in this question. This week, we're glad to have on Politics and Polls Professor Laurence Steinberg, who recently wrote an opinion piece in the New York Times on the likelihood of a safe reopening and what stands in the way. He's got special qualifications on this topic. Dr. Steinberg is one of the world's leading experts on adolescence. He's a distinguished university professor and the Laura H. Carnell Professor of Psychology at Temple University, not far from here. Dr. Steinberg is also the author of more than 450 articles and essays on development during the teenage years, and the author, co-author, or editor of 17 books. He's written not only for the New York Times, but also the Wall Street Journal, the Washington Post, USA Today, Slate, and Psychology Today. He's a graduate of Vassar College and Cornell University. And finally, Dr. Steinberg is a fellow of the American Academy of Arts and Sciences, the American Psychological Association, and the Association for Psychological Science. Larry, thank you so much for joining us today.
Well, thanks for having me.
So let's just leap right in. Start as a starting point. Let's talk about the piece that you had a couple weeks ago in the New York Times. And the title was "Expecting Students to Play It Safe If Colleges Reopen is a Fantasy." So I'm going to speak from the perspective of purely technical grounds. On purely technical grounds, one might imagine being able to distance and test and trace. And it's something that they're working on in South Korea with some success. Tell us about why we might want to pause before doing that.
Well, I think a lot of the discussion about how to return to campus in the fall has focused on the mechanics and the logistics of it. But it surprisingly has ignored the people whose behavior we're trying to change or hope to change, and that's the students themselves. For the past 20 years or so, my lab has been studying decision-making and risk-taking in this age group. And like others, we find that people who are between 18 and 22 or so are more likely to take risks than people who are older than that. And I think, moreover, there's a lot of research that suggests that simply educating people this age is not going to deter them from taking risks. My main concern, and the reason that I wrote the op-ed in the Times, is not about how to structure the classroom. I think that's probably doable by requiring people to wear masks, by using plastic shielding, and by spacing seats appropriately. But my concern is about what goes on in the dorm when it's much more difficult to regulate young people's behavior. Today, in fact, in the New York Times, on the front page of their online site, was a news release about the fact that a disproportionate number of young people is accounting for the current surge that's taking place in the South and the West. And it coincides with opening up of bars and other places where young people can socialize. So even though people this age have been told to socially distance, to wear masks and so forth, they're not doing it. And I don't see anything different from this happening when colleges reopen.
Now, how much of that is inability to follow distancing protocols, and how much of that is a conscious decision that the risk of severe illness or death in my age category isn't that large, so why don't I just go ahead and hang out with people?
I think it's probably a little bit of both. I think it's partly a function of the fact that the news coverage of this has led people to believe that young people are kind of immune to this virus. And moreover, I think our constant focus on deaths as opposed to morbidity, I think leaves young people to feel that they are safe because they're not going to die from it. They might not die from it, but we now are understanding that exposure to the virus may damage lungs in ways that are only seen years down the road. So by focusing everybody's attention on how many people are dying, I think we're misleading the public in general that there can be many, many adverse consequences of being exposed to this virus that don't necessarily lead to death or don't need to lead to death immediately. Right.
I've been reading about ground glass opacities appearing in people's lungs, and these appear even in asymptomatic people, including young people. Here at Princeton, I advise neuroscience students in the laboratory to do various kinds of thesis work. And one of my students is on the track team, and she was debilitated and she couldn't leave campus when we evacuated the place because she was basically too weak to stand, too weak to walk. This is a healthy young woman who runs track. I mean, this is, I would say in the upper deciles of physical condition of college students. And yet she couldn't get up, couldn't walk more than a couple of steps, was basically stranded in her room. Eventually, after a couple of weeks, was able to rent a car and drive home to the Midwest after some amount of recovery. And, that would be an example of somebody who was probably nowhere close to dying, but very clearly debilitated by it. And so I think I see your point. Those stories don't really get talked about that much.
That's right. And this student may discover when she's in middle age that the damage that the virus did to her lungs when she was in college is now showing up in the form of other kinds of lung disease and lung problems. So now, one thing that I'm interested in here is that you said education isn't going to work. I guess it's not hard, based on my experience. Students are able to cognitively answer all kinds of questions really easily. Like they can pass their driver's test, they can solve calculus and other kinds of scientific problems, they can write persuasive essays. All these are cognitively things that they can do really well. So surely they can learn these simple distancing protocols. So let's talk about the disconnect there between that and what they do. Sure. Well, I think we know that there are many instances in life, and this is true for adults as well as for adolescents, where our behavior doesn't follow what we know we ought to be doing. Right. So a simple example might be that you're late for an appointment that you're driving to, and you go over the speed limit, even though you know that speeding is against the law and you might be ticketed for doing that. Adolescents in this country get a lot of health education about safe sex, about not smoking, about not binge drinking, but yet a fairly significant proportion of young people do those things anyway. Now, I think that especially when it comes to social activities, like socializing in the dorms, it's really easy for college students to just ignore what they know. I mean, they get caught up in the moment. They're at a party. They may be drinking alcohol. Mm-hmm. They're in groups, which we've shown also undermines decision-making capabilities during this age. So I don't mean to demean young people, but they are at a stage in their development where they do find it more difficult to control their impulses and comport their behavior in a way that's consistent with what they know. I mean, this feels to me like, just to use the language of reward and so on, when we make decisions, we have to weigh how much an immediate reward is worth and how much it's going to be worth to us to, say, be healthy 10 years from now or what have you. And it feels to me like that this has a lot to do with discounting future bad and good events. And here you've got you've got your friend in front of you. You're going to go out and hang out someplace. And that seems really fun right this moment. And if you've never had an adverse health event, then the negative costs just don't seem very obvious. So at some level, it doesn't seem necessarily irrational. It's just a different weighting of a different kind of reward, as opposed to something that might affect the health of, I don't know, everybody around them. Like if I encounter, I'm not in a risk group either, but I don't know, my students become asymptomatic carriers, and they may be fine, but what about the food service workers around them or whatever? Right. So in our lab, we not only study real world risk taking, but we also do experiments in which we test to see if there are age differences in sensitivity to reward or age differences in preference for immediate versus long-term reward. And you're absolutely right. So this is an age when people are more likely to discount the future and to be more attracted to and responsive to the prospect of immediate rewards. That may make a certain amount of evolutionary sense, but it doesn't make sense in the current situation. And you raised an important point. It's not just the health of the students that we ought to be concerned about. It's the health of the adults that they come into contact with on campus, including people like us who are teaching them, but also the university employees and members of the surrounding community. So if you have kids walking down Nassau Street in Princeton who are asymptomatic carriers, but they're interacting with people in stores and in supermarkets and so forth, they may then be infecting people who are older and who are more vulnerable to the terrible consequences of contracting the virus.
What about, I'm going to keep on clinging to this idea that there's somehow hope, because I'd kind of like to get the students back. And so I'm going to keep on asking questions like that. What about interventions like environmental control and peer support and peer pressure? So for example, I'll give you an example. A few years ago, maybe it was about 5 or 7 years ago now, there was an outbreak of meningitis. And it was here and elsewhere. And we at Princeton undertook a vaccination campaign, and the student organizations made it cool. They had lapel buttons. Do I have one here? Let's see if I have it here. They had lapel buttons that said "Defeat the Mang," and it became this cool thing to get a meningitis vaccination, and we achieved vaccination rates of over 90%. So that seemed like a pretty good accomplishment. Are there interventions that would open the possibility of making it easier to comply, or bringing in peer pressure to make it really lame not to?
I think you probably can, but my suspicion, having taught people this age for more than 40 years, is that is that a one-time intervention like getting a vaccine is quite different from changing your behavior for a long period of time and maintaining that change. So, as I wrote in the essay, I think that probably what we will see is that for the first couple of weeks of the fall semester, the beginning of the fall semester, there will be fairly widespread compliance with the guidelines. And the universities may use things like peer models and reminders and so forth. But I think after a couple of weeks, the students are going to get antsy and they're going to really want to socialize. I mean, I think that we're seeing that now in the country writ large, that individuals were following the guidance for a while, but then they just get tired of it. They get bored, or they're angry that they have to be cooped up or whatever. So I'm not sure. I've thought a lot about this, Sam. I've thought, well, rather than just being completely pessimistic about this, what kinds of suggestions can we make about changing the context in which kids are in school in ways that are going to push their behavior, to nudge their behavior. That's the term that cognitive scientists use, to nudge their behavior in the right direction. The problem is that in order to control the spread of the virus, you have to have widespread compliance with this in a community where people are living in such close contact. So what are you going to do about communal bathrooms, for example? And we now know that the aerosol that can transmit the virus is released when people flush toilets. So, it's not so easy to do, right?
Yeah. I've read either in a review article that you wrote, or I can't remember where I read it, but the role of adolescence in some societies seems to be have social benefits. For instance, young adolescent men patrolling the edges of a village and doing things where they have that energy and that intense in-group cohesion, that sometimes that energy can be used for positive goals. And so does that give any insights into ways, I'm not even sure I should suggest this, but have patrols of students who take it on themselves to create peer pressure? Or is that, it's funny, even as I say it, it just sounds like a bad idea.
Well, I think that we often talk about peer influence during adolescence as a negative thing, but as you point out, peers can also influence adolescence in a positive direction, right? So we hear a lot about peers who might encourage their friends to try drugs, but we don't hear about the peers who are discouraging that behavior in their friends. So both positive and negative influences exist. I can't remember the university specifically, but there is some place that I read about that is going to try to have undergraduate ambassadors who are not so much patrolling the campus, but are out there reminding their fellow students to wear their masks and so forth. I just think on a Friday night, once the party gets going, it's just difficult for me to see widespread compliance with the social distancing guidelines.
Right, because alcohol flows, even in any person, young or old, behavior is disinhibited. And whatever it is that gets decoupled, prefrontal cortex or whatever it is that tells us not to do things, it takes a vacation. And at that point, just whatever we want, we grab and we take, whether it be another drink or standing next to somebody interesting or whatever it might be.
Right. And in addition to that, in our lab, we have shown in a number of experiments that the mere presence of other people who are teenagers or adolescents, young adults, increases risky behavior. So even without alcohol, the fact that the college students will be living in groups with same-age individuals in basically unsupervised settings, to me, is going to increase the chance of them following their impulses rather than doing what they know they ought to do.
You are describing some of the pleasure of going to college.
Absolutely. And we don't,
Right.
we don't, right? I mean, we don't want to, like you, I'm really eager to get back in the classroom. I don't believe for a moment that I can be as good a teacher or mentor to students through online instruction as I can in person. But it seems to me that as opposed to some other situations that we find ourselves in, at least we have a backup plan that we know is not a terrible plan. I mean, after all, if remote learning was so bad, why are so many universities doing it anyway? I mean, they were doing it before there was the pandemic. So there is some belief out there that we can teach college students through online instruction. And it seems to me that to be safe, that's what we should be doing this fall till we see what's happening to the prevalence and the spread of the virus.
Right. Hey, I would wonder, now that we've seemingly done a pretty good job of demonstrating what an incredibly poor idea this is, I wonder if I could talk with you as a fellow academic at another institution about strategies that we've used to deal with either our students, our research groups, and what's happening at our schools, what is actually happening at Temple and Princeton for the fall. And I wonder if it's okay with you, I'd like to change the topic a little bit and just hear about what have you been doing to adapt to the young people around you, whether students or people who you mentor? Like, what is life like now as a group leader?
Well, I'm in an unusual situation in that I wasn't teaching this past semester. And actually, I'm sheltering in California at the moment because that's where my wife and I were when everything kind of went down the drain. And so because I wasn't doing formal classroom teaching in the spring semester, there was no reason to go back to Philadelphia. I'm still out here and I'm still communicating with my students and former students over email and telephone and so forth. I have to say that a lot of the communication that I've always engaged in with my students since the advent of email has been electronic communication. I travel a lot for work and students want to reach me and I want to be in touch with them. So we've become accustomed to that. I think the important thing to me as a teacher is understanding that people this age learn much better when they make a social connection to the person that's teaching them. And that I think is more important than the pedagogical competence of the person doing the teaching. It's forming that relationship and creating a bond where the student really cares about doing well because of his or her relationship to you as the professor. I think that's going to be really hard. So in the fall, I'm teaching remotely in the fall. I made that request to Temple and they granted it. But that's different than what happened this past semester because I will never have face-to-face interaction with these students in my class. That's very different than what happened this past semester where you had half the
prior
semester,
relationship.
let's say,
Right. They
and
were
you had a
committed to it.
relationship. And so I think that probably made the online learning more successful than it will be when classes start online and never go to face-to-face.
Yeah, I'm a bit concerned about that because let's say hypothetically, the way things are headed now, I mean, as we're recording this, the coronavirus rate has spiked to, it's approximately doubled in the last week or so. It seems to be increasing honestly, at rates that resemble the initial uncontrolled spread, where in the very earliest phases, it was a doubling every 3 days. Now we're doubling, I don't know, maybe every 5 or 6 days, but it is a rapid increase. And it feels like we're headed for everything that happened in the Northeast, which you were very fortunate to miss. Everything that's happened in the Northeast looks like it's happening all across the Sun Belt, in the Rocky Mountain states, in the West Coast where you are now. And it looks like I just am having a hard time imagining this getting under control by September. And decisions have to be made about reopening before then, like basically in the next few weeks, I think.
Right. There were 45,000 new cases yesterday in the United States.
Yeah.
And that's quite extraordinary, I think.
Yeah.
So maybe we could get on a different topic that I think we need to talk about,
Absolutely.
which is that in some senses, this is a financial problem, right? I mean, that's the reason that colleges and universities want to reopen, because they'll lose too much revenue if they go online, either because students won't want to pay the full tuition, or because they won't be renting out their dorms and providing food service. Some students may decide to take a gap year and not go at all. A good friend of mine is the president of a very prestigious 4-year liberal arts college. And she told me, I won't quote the figure, but she told me how many millions of dollars their institution is going to lose if they have to go to total online instruction. I don't know what the situation is like at Princeton. You all have a pretty big endowment. Temple does not. And I think that my administrative colleagues at Temple are just worried about what's going to happen to the school's financial state if they have to go remote. Now, that leads me to think, well, can we find a financial solution to this problem if that's the root cause of the problem? And I don't know what the bottom line figure is. It wouldn't be impossible to figure out. But perhaps if we went to total online instruction everywhere in the United States for college and university in the fall, Congress can pass legislation that's going to bail out colleges and universities. After all, this is a short-term financial problem. Sooner or later, we're going to have a vaccine, and places will be able to return to normal.
Maybe even maybe by the end of this calendar year.
Exactly. And if we can bail out businesses and banks, we can bail out colleges and universities, which are an incredibly important part of life in America and of our economy because of the human capital development purpose that they serve.
I see. So how much would this cost? Tens of billions, something like that?
I don't think so.
Or you think less?
Well, no, maybe tens of billions. An economist and I were chatting about it, and we thought maybe $250 billion for the academic year. 250
billion or million?
Billion with a B. That's assuming that schools lose half of their incoming revenue.
That's a lot of money.
That's a lot of money, but I mean, what's the alternative? I mean, if a lot of these people get sick, that's an expensive proposition.
Right. So it is $1 trillion hit to the economy to be debilitated by pandemic, and so consequently, the idea would be to take this exogenous shock and find a way to make us all whole and just keep it together. The same way that unemployed people got temporary benefits, do something to prop up colleges and universities so that they can say, because if I look around here, I mean, the kinds of consequences here at Princeton are, I don't know, my pay is frozen. So far, there's been a commitment not to fire staff, but guess what? Like, how long can that be kept up? I mean, there's been a pretty clear statements from the university administration to maintain that. But at some point, there is going to be difficulty doing that. At Princeton, probably it'll take a little while longer. But think of all the colleges, and you talk about Temple, but okay, what about colleges and universities with fewer resources? What about places that are dependent on public money? Right? I'm just imagining the bloodbath. That's interesting. So the idea would be to just basically a direct bailout of colleges and universities.
Yeah, either in the form of grants or loans. I mean, we can loan money at almost 0% interest right now.
Right, money is free. Right?
money's free, and we can let universities maybe pay it back over time, or pay some of it back over time. I don't know. This may be a pipe dream, but it seems to me that it should be something that people are talking about as to whether if the reason that so many places are inclined to reopen is that they're afraid of losing this revenue, is there a way we can provide a stopgap measure to keep these places funded?
So the problem right now is that requires congressional action, and right now the executive branch is not terribly functional, which is a big cause for how we got here, and then we would rely on the Senate and the House to act, and so this requires them to recognize the crisis at hand. So and it has to happen in time for the school year, so it has to happen imminently, like in the next month or two. And I believe that we're about to hit summer recess if we have not have it already for Congress. So practically speaking,
it's probably not going to happen.
Well, one can think of some barriers, because my first reaction to your suggestion was maybe at the end of the year after the election, one can imagine it happening, but that's too late.
Right. So then the question is, I don't know what your experience was like. What was the financial cost of changing from in-person to remote instruction? Now, maybe there was, I'm not sure, because I think at that point the students had already paid their way, and so the universities weren't giving any money back to them for transitioning to remote learning. But there are going to be some costs to doing that. I think a lot of places sort of think about, well, what are we going to do if we find out in the middle of October that this isn't working? And how are we going to, bail everybody out here?
So the idea is that they show up on campus and then there's like outbreaks, and then students have to be sent away again, which is just like the evacuation that happened this spring all over again.
That's right. Yeah. That's right.
No. So about 120 days till the election, and you're talking about a solution that could possibly work if administered before the election. So good luck to us all.
Yeah.
Let me, maybe just in the last minute, I wanted to talk a little bit, just at the very end of our conversation, back to something I think that is a little bit more within our control as educators, which is with all these new freshmen arriving, whatever happens, it sure seems like there's going to be a lot of online teaching of incoming freshmen. How are we going to either build social connections with our students, and how are they going to build connections with one another, where the normal picture is mom and dad drop off the kid with the favorite stuffy and the computer and other knickknacks that go into the dorm room, goodbye, and then they all go and hang out together? What are we going to do about the mental adaptation and well-being of these freshmen as they hit college this fall under, let's say, remote conditions?
I think it depends on in some senses, on their expectations. Let's remember that you and I both teach at essentially mainly residential universities. A lot of kids in this country live at home, or they live in apartments, so they don't have the dorm experience. Remember, a lot of students in this country go to community college, and so it certainly. It's not desirable, but I don't think it's an impossible thing to do. Interestingly, when discussions at Temple started about what to do, the two groups of students that the administrators wanted to come back to campus were freshmen, in order to form that bond to the institution, and seniors, in order to make them feel positive about the institution as they're leaving. And so I think
that's what I would do. That's exactly what I would do. I would get it down to just half or fewer of the students in exactly that way.
And maybe the freshmen will be more likely to behave themselves because they haven't yet been socialized into the idea that college is about, Thursday night partying,
So if we just have the freshmen, then there's no eating clubs, so this is what we have on campus where the students do their drinking. So no eating clubs, this is good. So just have the freshmen come in, and then and as vaccines come online, then let upperclassmen back on campus.
Right. Yeah.
That doesn't sound crazy. No,
it doesn't sound crazy. There's this thing that I read about today called pool testing. Do you know about this? Where they test a large number of people at the same time, and if no one in the group tests positive, then they just assume that everybody's okay and they can go on and do what they were being tested for. So you could do widespread testing of students. And then the problem is that, let's say you're testing 30 people at the same time, and one of them, it turns out to have a positive test. Then you've got to identify that person and quarantine or treat or something like that. Maybe it would be possible to do wide scale testing. The other issue is how much that costs to do if you have to do it repeatedly over the course of the semester. Because you can't just test somebody on September 1st and assume that, in November the person isn't positive.
Right. The exception would be antibodies. So I find that a really useful guide in all of this is a movie, which is the movie Contagion by Steven Soderbergh. And it has remarkable levels of detail about all these things, where people go around with bracelets indicating that they bear antibodies and therefore have some measure of immunity. And just the procedures of quarantine, of braceleting people, of color coding people. Imagine a group of 30 people getting tested in a pool, and they all get, lavender bracelets. And then the lavender group is now known to be together and as a group clean. So one could imagine it working, but it would be a pretty elaborate level of planning. And I'm not sure I've heard very much about that level of planning yet.
Right. I think it's also expensive. So that's another, another line item that needs to be accounted for.
All right. Well, Larry, thank you so much for joining us. As I'm looking at spreading statistics on my web browser, and I'm just going to close that and ignore it. But we've been talking with Larry Steinberg, one of the world's leading experts on adolescence. He had an op-ed on June 15th in the New York Times about whether it's possible to make college reopening safe, and all the difficulties that have to do with the minds of our growing young charges who are developing and improving in so many ways, but self-restraint comes last. So Larry, thanks for joining us today.
Sure. Thanks a lot, Sam. Take care. Be well.
You too. So everyone, thanks for joining us for another episode of Politics and Polls. You can hear us on SoundCloud, Spotify, wherever fine podcasts are purveyed. And you can also listen to back episodes at politicspolls.princeton.edu. I'm Sam Wang, your host, and until next time, stay safe.